it became very, very dark and very shadowy. And I knew it was happening, and I also knew that there was no way to prevent it from continuing to happen. And that was a very, very scary time, because as my sight degenerated, I didn't know if it was going to go to complete black, to contemplating not only complete vision loss in my left eye, but the possibility that I could be blind in both eyes. HB. HB.
This one.
My experience with Nyon started after a really busy trip to New York. I took a red eye out and then was flying back that night. And I remember feeling really fatigued, but I was with somebody and was not able to take a rest. I went to sleep that night and woke up the next morning, and I felt that my eye was sort of shadowy. I felt that there was not as clear vision, not as a clear ability to see, especially in the lower part of my eye. And my anxiety level went up. So I called my ophthalmologist and asked her if I could come and see her. And that was the first time that I started learning and hearing about how I potentially had a stroke in my optic nerve.
NION, or non-arteritic anterior ischemic optic neuropathy, also known as optic nerve stroke, is the most common acute optic neuropathy in patients over 50 years old. I think the part that's so devastating about it is that it's very sudden. You go from a healthy person with perfect vision suddenly to basically seeing this black shadow in one eye. It can be a smoldering process where there's a shadow on the lower portion of the vision, and then it slowly crosses the center. For acute optic nerve stroke, there's currently no effective therapy.
So I first went to the Byers Eye Institute based on a recommendation from my ophthalmologist. I had heard from another friend of mine who actually had Nyon that Dr. Barris and Dr. Joyce Liao were the best in the world. The scariest thing for me was during that time when I would close my good eye and try and envision a world with my left eye, and that being what my sight would be.
There's a critical period where intervention is key. People will ask, is my vision going to be restored? What happens if I'm blind and unable to work? We're with them. We're actively doing the research, and so whatever treatment we offer is really the state of the art of the field at the time.
We did not only a series of tests for several hours, but we spoke as friends, literally in the first meeting. This is what this means. This is what could happen. This is the worst case scenario. This is a best case scenario for you, and you're going to be okay.
We were pulling out all the stops, basically, using an eye drop to lower the eye pressure, which improves the blood flow going into the eye, and by reducing the resistance that it's pumping against.
I started going into a barometric chamber 3 hours every day to try and reduce the tension in my optic nerve.
And then finally, when these really didn't seem like it was enough, we had some interesting discoveries in the laboratory that showed that medicines that could reduce metabolic stress can potentially be used to treat optic nerve stroke. With this combination of therapy, we were able to pull back the shadow that was growing so that we were able to save the central vision.
I knew that they were doing everything they possibly could.
I think about it as this is the absolute, opportunity to make a difference. If we don't investigate this, then who will? No other institution is tackling this condition the same way that we are, because we're able to leverage the resources that's possible because of the amazing team that we have built at Stanford. There's not a race out there for this condition, but we are acting as if there is. And we would like to be the first ones to really make an explosive, accelerated string of discoveries.
I think it's really important for people like me and other people in the community to philanthropically support the Byers Eye Institute, because the money is needed to make advancements.
Optic nerve stroke is an orphan disease, meaning it is rare enough that it's actually difficult to get funding. This is the kind of thing that you can make a difference in. There's just not enough funding to address the needs that are out there.
5 years ago, Nyan was a very different prognosis than it is today, in large part because of gifts that people have made to that program that have allowed them to do clinical work that is affecting outcomes.
Some of the new strategies that this kind of funding allow us to do is to do these deep investigation at the patient's level.
I feel remarkably more comfortable with my reality. If I were to lose my right eye, I would still be a viable, happy human being. And that's the lesson that even though I've lost things, even though I can't do certain things, those are secondary to being a human being and recognizing that I came out on the pretty good side of a bad situation.